So yesterday we started the topic about the normal flora, and we were discussing about the different type of bacteria which are present in our different areas of a body, and they make our they reside there, they colonize there, and they prevent us from the infection. So we have discussed about the bacteria which are present in gut. So gut is the major if we calculate, so majority of the bacterial population, it is present in gut. So we were discussing about the respiratory tract. So respiratory tract microorganisms, like they are present in our mouth, nostril, bronchi, alveoli. But when we move from up to down, it means from nose to lungs. So the number of bacterial population, it become decrease and decrease. It become lower and lower. So alveoli and the the alveoli and the bronchial tree or the bronchi, they have lower number of bacteria as compared to the nose, throat, and mouth. So most common, because yesterday I told you about the difference between anaerobic bacteria and aerobic bacteria, like where they mostly reside. So aerobic bacteria, they mostly reside in the region where they are exposed to air, where oxygen is present. So that is why most of the upper respiratory tract infections, the gram positive aerobic bacteria, they are involved. Okay, so and the lower respiratory tract infections like GIT infections, alveolar infections like pneumonia, urinary tract infections, in those areas mostly except lungs, because lungs there is an air. So in lungs there are gram positive bacteria, gram negative aerobic bacteria. They are present in the lungs, but with them that may lead to a pneumonia. But in GIT or urinary tract infections, mostly the gram negative anaerobic bacteria are involved, because in lower respiratory tract there is no oxygen, the bacteria is not exposed to air. So that's why mostly those bacteria are gram negative anaerobic bacteria. And from the nose, we have discussed mostly in our mouth, or in our nose, we have Staphylococcus and Streptococcal species. They are more prominent, and that is why if somebody have sinusitis, or if somebody have nasopharyngitis, so these bacteria can be spread within the confined facility. For example, some healthcare facilities, old homes, nurseries. If one person is having infection, especially the nasopharyngeal infections, so due to sneezing, coughing, through the droplet, these bacteria, they can spread in the atmosphere, and they can affect the other people as well. So the next we also discuss about the throat. In throat, mostly the viridian species is the most common one, viridian species. And within the viridian species in mouth, the Streptococcus mutans, that is the most common bacteria which cause a plaque production. So plaque is what? Plaque is a gelatinous compound that is produced by the production of proteins, who produce this protein? That is Streptococcus mutans. So this viridian species, they are also involved in some systemic infections. As I told you yesterday, that mostly these Streptococcus viridian species can lead to a infective endocarditis, and that infective endocarditis can cause the cardiac arrest or heart failure. So it's as well as these Streptococcus viridian species, it is also very common to cause these valvular heart diseases. Okay, so valvular heart diseases, and that valvular heart diseases ultimately lead to some rheumatic, like for example, mitral stenosis, mitral valve regurgitation, tricuspid valve regurgitation. So you will study these valvular disease later. So that is why only a simple mouth flora can, once it enters into the systemic circulation, that will lead to this disease. Another important point for this Streptococcus viridian species are because these species can cause valvular heart diseases, and collectively we call this valvular heart diseases as a rheumatic fever or rheumatic heart disease. That disease we call it a rheumatic heart disease. Rheumatic heart disease. And rheumatic heart disease is common because this rheumatic heart disease, when you receive a patient who presenting a sign and symptom of heart failure and the sign and symptoms of valvular disease, you should need to ask about the history of sore throat. If a patient have a history of sore throat, it means that it might be a rheumatic fever. Then infective endocarditis, I told you that infective endocarditis, this is also an emergency. Actually, that will lead to a heart failure and other complications. So infective endocarditis, viridian species are involved. And remember, and this species is very much common in IV drug abusers. So these bacteria, they enter into our systemic circulation due to sharing syringes. So IV drug abusers, they can this disease, infective endocarditis, is very much common in those people. And which bacteria is involved? Actually, viridian species is involved in causing infective endocarditis. Then I have explained you that the anaerobic bacteria, they are also present in our mouth, especially they are present in the condition where there is less oxygen. For example, gingival cerevisiae. Cerevisiae, like it's a gum, deep in the gum. So because there is a less oxygen concentration, so these bacteria cannot survive in oxygen. So that is why they are present in these sites. The next we have the genitourinary tract. So genitourinary tract, when we discuss first about the females. So remember, females are very prone, they are very prone to having recurrent UTI. Can you tell me the reason? Can anybody tell me the reason why females are very there are more prevalence of recurrent urinary tract infections in female as compared to male?
The urethra
Because
is shut.
Yes, yes. What?
The urethra is shut.
Urethra is short. Uh, any other reason?
Maybe, sir, because of the condition, maybe it's kind of moist. So that's why more.
No, no.
we have bacteria.
Yeah, it is caused by bacteria, but females are very much suffer this recurrent UTIs. Anatomical reason. Okay, I have given you a hint. Anatomical reason. No.
It is
Uh-huh.
exposed to air.
No. Okay. Uh, the anatomical reason for this, for recurrent UTI is, you remember we have discussed that 20% of the feces, 20% of the feces, they are composed of anaerobic bacteria. You remember? Yesterday we discussed feces. 20%, it is the feces composed of anaerobic bacteria. Anatomically, the urethra and the anus, the distance between the urethra and anus is short anatomically. So due to which the bacteria can easily enter into the urethra from anus. So that is why the females, they are very prone to having UTI, recurrent UTIs. Okay, this is the
I
anatomical
knew it.
reasons. What?
I knew it, Sarji. But
So
I
then
wanted to check if you know or if you know or not.
Okay. So you are checking my knowledge. Ah, good. Okay, so genitourinary tract, normally in youngs, like before puberty, there is a very low estrogen level, as well as after the menopause, there is a low estrogen level. So that is why in this condition, the vaginal pH is more basic, okay, is more basic. But during a fertile period, like after puberty and before menopause, most of the normal flora of the vagina, that is actually composed of this lactobacillus species. So lactobacillus species, why it is present there? Lactobacillus, this bacteria, uh, it actually it actually regulate the pH of the vagina. We know that the pH of vagina is acidic in nature. pH of vagina is acidic in nature because this lactobacillus, it convert the glucose into lactic acid in the vagina. So that is why the pH become low, and we know that in acidic pH no other bacteria or virus or any other organism can grow at low pH. So in adult woman, the vaginal pH is low because of this lactobacillus. And the same bacteria is responsible for producing yogurt. Lactobacillus, we use this bacteria for production of yogurt. Okay, so this lactobacillus, it prevents, because it regulates the pH, so it prevents the growth of some other pathogenic organisms. So if a person is using broad spectrum antibiotics, if a female is using a broad spectrum antibiotics due to some other reasons, like for example sore throats, some other kind of infections, so the local uh, flora will also be disturbed, because antibiotics can kill the bacteria, so lactobacillus will also be killed. So if a person is using long term or a broad spectrum antibiotic, so the normal flora will be killed as well. So lactobacillus will be killed after using the antibiotic, so that will lead to a overgrowth of fungal infection, that is Candida albicans. So Candida albicans is a yeast or a fungus, and that Candida albicans, that will lead to a candidiasis. The disease name we call candidiasis. Or the complete name of this disease is candidiasis vaginitis. Sometimes we also call it fungal vaginitis, very like this is the name of the disease. So this is a fungal growth. It's a fungus or a yeast infection. So that will grow if you disturb the normal flora of vagina. So that is very common if a female is using antibiotic, broad spectrum antibiotic. So we have some other bacteria. They are also present in the vagina, that is Staphylococcus species. Okay, so so the females who are prone to recurrent urinary tract infections, they are also have the bacteria which can cause these infections. Most common urinary tract infections that are caused by E. coli and Enterobacter species. Okay, and E. coli and Enterobacter species. These organisms, they are involved in recurrent urinary tract infections. And because I told you vagina is close to anus, so that's why the colonization of E. coli is a normal flora of our urethra. So E. coli can, due to urine, like after passage of urine, okay, so that urine drops may contain E. coli, and when it enter into the vagina, that will cause a colonization of E. coli and ultimately lead to a infection. Another bacteria, we have the streptococci. So streptococci, they are also present about 15 to 20%. in the vagina, okay, along with this lactobacillus species. So this group B streptococci, which are also present in vagina, uh, that may cause meningitis. They may cause a neonatal meningitis, because if this group B streptococci are, because this group B streptococci are present in vagina, so during the pregnancy, this group B streptococci can enter into the neonate or the fetus, and if it enter into the fetus, that may lead to a meningitis. Okay, so group B streptococci, they are also present, as well as Staphylococcus aureus. It is also present as a local as a normal flora of the vagina. But remember, Staphylococcus aureus, it is about it is very like it is present, but in about 5% of female, not too much. But these bacteria, they are present as a local microbiome. They form a local microbiome. But whenever there is a depression of immunity, or if they invade into the systemic circulation, then they lead to a certain systemic infections. So Staphylococcus aureus, they are linked with a septic shock syndrome. Septic shock syndrome. So vaginitis, bacterial vaginitis, that may lead to a septic shock syndrome. So let's that is a for the vagina. And next, about the urethra. You remember, you know, our urine in a normal healthy person, our urine is sterile. So in our urine, there is no bacteria, there is no virus, there is no fungus. So in healthy person, the urine, it is sterile. It is sterile. But when the urine pass through the urethra, when it pass through the urethra and reach to the outermost part of the urethra, so we know that the outermost part of the urethra, it is a skin. It is a skin. So the outermost part of the urethra, when it reaches to the outermost part of the urethra, so the skin bacteria, the skin normal flora, that is Streptococcus epidermidis, that actually contaminate the urine. Okay, so that may contaminate the urine. So that is why there is, you know, for example, if some patient comes to me for a and he is having some urinary tract infections, and if I want to ask a patient that you need to do some urine test. So for urine test, you require urine sample. Okay, so then we can check the urine under the microscope and look for the bacteria as well as the blood cells. So for urine test, when I give a bottle for a sampling to my patient, I will ask the patient, you need to take a midstream urine. What do you mean by midstream urine? Don't take the sample at the beginning of your urination. When you reach at the middle of urination, then you need to take the urine sample. Why
Sir,
I
how would we found out that we are in the middle of urination?
okay, you are urinating. Okay, so maybe, you know, like, okay, maybe for 1 or 2 seconds the urine has passed. Okay, so you know your bladder is still filled. So everybody know that, like, he or she is in middle of the urine or micturition. So the concept is like, it is not exactly the midstream. It means that you shouldn't need to take the sample of urine, or the urine which comes first, which come out first. You don't need to take that urine, the urine which is coming at the beginning. So you need to wait for at least 1, 2, or 3 seconds and then take the sample. Okay, so this is actually the concept of this midstream urine. Okay, Saad?
Yes, sir.
Okay. So why we need to ask the patient to take the midstream urine? Because at the beginning, when urine is passing through the urethra, it will clean out, because urine is sterile. I told you urine is sterile. So when urine pass through the urethra, the bacteria which are present on the external urethra, that will be cleaned out, washed out. But if I take a first stream, if I take the first stream of bacteria, first stream of urine, so what will happen? At the beginning, okay, so if I take the sample, what will happen? This Streptococcus epidermidis, that will contaminate the urine, and when I check the bacteria, when I check the urine test, when I perform urine test, this bacteria will be there. So that will lead to a misdiagnosis. That will lead to a misdiagnosis of the infection. So that is why this is actually a counseling point when I need to take the urine sample. So the urine sample should be taken at midstream or after, once you begin. So just wait for 2-3 seconds and then take the sample. Okay, class, understand?
Yep.
Okay. Another most important thing is for females, like the outer covering, the outer region of the urethra, it also contains some mycobacterium species bacteria. For example, mycobacterium that is mycobacterium smegmatis. Let me write this. Segmatis. Mycobacterium segmatis. This bacteria, SMEGMETIS, smegmatis, Mycobacterium smegmatis. This bacteria, it is also involved in urinary tract infections, and this is also present in the outer the outlet of the urethra. So this is a Mycobacterium species, and this infection is very much common in uncircumcised male. The male who are uncircumcised, there is more chances of these infections, because the foreskin, it actually, after the urination, the foreskin, some of it helps for the growth of bacteria. So that is why the sexually transmitted diseases are very much common in those male who are uncircumcised. Okay, so that was about the bacteria which are present in our genitourinary tract as a normal flora and their relevant uh, diseases. Okay, so any question? Okay, so now go back. Sorry. Now, what is the significance of the normal flora? What is the significance? So significance, first of all, we know that the bacteria, they actually provide us to develop our immune system, You know, maybe you have seen here in China, like I'm talking about here, but in our country, our children, they play outside, they play like, you know, when we compare the childs, where the child who are playing in soil, the child who play in soil, he or she
Sir, I
will have
myself have
less,
played a lot.
huh? Okay, so
I
he or
myself,
she, Yes, Kothar, yes, you are right. Yes, you're right, you're right. Okay, so immune system, like the development of immune system, this bacteria, these bacteria, our normal flora, it also help to produce, to actually strengthen our immune system. And I was telling you, like the children who played or who are playing in soil, they will have less chances of infections. They will have less chances of infections as compared to the child who never played outside. Why? Because when we expose to some bacteria, exposure can lead to a production of antibodies. But if the bacteria is not exposed to our body, there will be no antibodies. So ultimately, there will be no immunization. So this is a type of acquired immunization. So that is why you may have seen that in China, some of like parks, they have some place where there is a soil, and the children, they play in that soil, because soil, it has lot of bacteria. So when you expose to the soil, when you expose to the bacteria, your body will produce immunization, sorry, antibodies, and you become immunized against those bacteria. So anyhow, so in our body, these microbiomes, they help us to develop certain immunomodulatory antibodies. For example, the microbiomes or a normal flora of our gut, they help us to produce, to develop a gut associated lymphoid tissue. Gut associated gut associated sorry gut associated lymphoid tissue. So gut associated lymphoid tissues, they are actually these are the lymphoid tissues which are present in our gut. So these gut gall system development, it is because of the gut bacteria. So if your gut associated lymphoid tissues are developed, it means you will have less chances of gut related infections, because the immunity is already there. But if those people, those persons who who do not have these microbiomes in the gut, okay, so they will never develop this gall system. So when there is no gall system, ultimately they will have less antibodies. They will have less antibodies, as well as they will not produce CD8 interepithelium lymphocytes. So lymphocytes, we know that CD8, CD4, CD8 cells, these are our immune cells, as well as we have T helper cells, T cells, T helper cells. So those people who do not have the microbiome in their gut, they will not have CD8 lymphocytes. Like they have lymphocytes, but they are not so much active, as well as they also have less number of T helper cells. So it means that these microbiome, they actually help us for the development of our immune response, immunization. Like this is the normal immunization, our own body immunization. So it provide a defense. Okay, so the next, because these bacteria, they colonize, in our area, like our normal cells or tissues or areas. So they prevent the colonization of some, they prevent the colonization of some pathogenic bacteria. So I have explained you before that if bacteria, they are residing here, so they prevent the entry of any new bacteria. So this type of resistance is known as colonization resistance. So these bacteria, they prevent us, the normal flora bacteria, they prevent us by colonization resistance, because these bacteria is already occupied the space, and when a new invader come, any pathogenic bacteria, so ultimately these resident colonized bacteria will produce certain antibodies, and that will cause the death, or that will actually lyse the invader. So that is why these bacteria are very helpful to prevent the entry of pathogenic bacteria into our system. The most important example of this, when you use, or the person who are using antibiotic, so antibiotic or antimicrobial drugs, we know that these drugs, they also kill the normal flora. So if a person is using antibiotic for a long term, there is a there will be a killing of gut bacteria as well. When gut bacteria is killed, so there is another pathogenic bacteria that is known as Clostridium difficile. Clostridium difficile. So Clostridium difficile is a very resistant bacteria which cause colitis, or that is actually we call pseudomembranous colitis. So utilization of broad spectrum antibiotics, that will alter the normal flora of a gut, and alteration of normal flora of gut will lead to a disease, that is colitis, inflammation or infection of a colon. And remember, this is a life-threatening condition, pseudomembranous colitis. So this Clostridium difficile lead to a pseudomembranous colitis, and that will lead to a toxic colon, and patient may die because of this situation. So that is why like when we we give long-term antibiotics, we should need to evaluate about the sign and symptom of this Clostridium difficile infection. And that is why sometimes we also, after using the antibiotic, we also give probiotics to replenish the normal flora. So this is a disease, and this is a significance, another significance of our normal flora. And another important significance is that gut bacteria, they digest, first of all, they digest the food particles which are present in our feces. Okay, so when the feces passes through the colon, these bacteria digest the undigested particles of food, as well as they secrete vitamin K and vitamin B. So vitamin K is responsible for coagulation, we know that. So these bacteria provide us the nutrition, as well as they help us in digestion. So if you kill these bacteria, what will happen? It will lead to diarrhea. So that is why long-term or a using of broad spectrum antibiotics, the patient may develop diarrhea because of there is improper digestion. Okay, we have less than a minute. After a break, we will continue. साथ क्यों तरसा रहे हो?